Okay, we're doing lab activity number 9, which is gingival descriptions. So you should have updated your patient's health history and obtained the necessary signatures. We're going to be using the clinic manual to chart our gingival specifics on your patient's assessment form, which is the yellow one. You're going to be looking at the following: color, size, contour, consistency, and surface texture. So the first thing that you should do is look fully at your patient's tissue.
I am looking at my patient's tissue. One of the first looks I'm going to take is to see if there's any reason I shouldn't work in this mouth today. Any open sores, anything that I'm concerned about. And as I'm looking through, I'm seeing that my patient has just a small red mark right here, just to the lingual of tooth number 15 in this area.
Okay, so we are going to start by marking anything that is a localized condition. So we're going to start on quad 2, and we are going to note any color changes in quad 2 from the general mouth.
Okay, as I'm looking in quad 2, I see that the color is the same on all of this area through here as it is on the right side if I compare it. So the color description is going to be, I'm going to say it's a nice light pink.
Okay, then we're looking at the size of the tissue.
The size of the tissue, I'm looking at how thick that is between the tooth and the outside of the world. And so I can see that this tissue is fairly flat and bound down. And so I'm going to say that that tissue is firm and tight.
Perfect. Now what's really nice is that your yellow paper actually has this lovely little box that walks you through this. We are looking at 6 descriptors, and it gives you an example for both healthy tissue and diseased tissue. And we're just walking down this list. So if you ever get like hung up and you can't figure out your word, a lot of times it gives you one where we just said it fits, it's nice and tight. Well, it fits snugly around the tooth. That's a great descriptor. Okay, so now on quad 2, we're going to look at our gingival contour. We have to have 2 things on gingival contour. We're looking at the margin, and then we're also looking at the papillary margin.
So I'm looking at the margin, and that's just this free gingival margin here. And as I'm looking along that, I'm seeing that those are all tight, flat, snug. I don't see any areas with swelling that's going along the edges here. And so what are some suggestions of words I could use for that one from the sheet?
So our margins, if we want to say they're healthy, we've got knife edged, flat against the tooth, it's scalloped. And then if we talk about the papillary, we're talking about pyramid shape, it fills the interdental space, it may be felt with a diastema.
Okay. So as I'm looking on my patients, I can see that this is all nice and flat. It's got a little bit of rounding, but that's natural. It's supposed to have a little bit. As I'm looking at the papilla, I'm looking for any descriptors that look abnormal, and I'm seeing that everything is coming up to a nice sharp point. It's not rounded. So as I'm coming up to these, I'm looking for that knife-edged point along that scalloping.
All right, we're also then looking for consistency. Some words we look for consistency are like firm or resilient to pressure. And if it's diseased, we're looking more at edematous, which is like fluid-filled or fibrotic. It's soft and spongy, dense with pressure.
So on this patient, as I'm pressing into the tissue is popping right back up. It's resilient. I'm not sinking far into the tissue. If I were pushing and sinking far into the tissue, I would consider that to be edematous and swollen. So this is resilient and firm tissue. It's in good shape. If, for example, this patient had been a smoker, or if perhaps they were a mouth breather, I might see maybe some fibrotic tissue across some of those.
All right, and the last thing we look for is surface texture. Stippling is a great indicator of healthy tissue. If we're looking at diseased, it might be smooth or shiny, loss of stippling, nodular.
So as I'm looking at this tissue, I'm seeing that there are just little tiny dots that look a little bit like orange peel. I'm going to find those just along the attached gingiva here, just to the level of where my Q-tip, my cotton tipped applicator stops. So in this area, I'm watching for that stippling, and I'm not seeing a ton of it, but that could be because of the lighting. And but this looks like really good, healthy tissue.
Okay, perfect. Now that we have looked at our patient's gingiva and we have got some really great descriptors, we only have one localized condition.